I'm Joe Halko, your host, and welcome to another episode of NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide a continuum of the highest quality services to meet the needs of individuals who at any point seek assistance with emotional and behavioral challenges, their mental health, substance use, or an intellectual or developmental disability. Recently, it was announced that NCSS has met the criteria to become a certified community-based integrated health center, also known as a CCBHC. The CCBHC certification creates stable funding and expanded services for the communities of Franklin and Grand Isle counties while reducing the obstacles to health care that many Vermonters face. To discuss this exciting news and what it means for our community, I'm pleased to introduce this month's guests. Todd Bauman, Chief Executive Officer, Belinda Bessette, Director of the Community Mental Health Services Division, and Tricia Ketchum, CCBHC Program Manager. And I'd like to welcome all of you to the program this month, and it's so great to have you here so soon after you got this terrific news. So, first of all, for viewers and listeners who may not be familiar with the term, what is a certified community-based integrated health center?
Well, I'll start with Joe. We are super excited to be here. This entire process has taken us a couple of years to get to. It's been a really heavy lift for our agency. Lots of different people have been pulling together, and we're just really excited to be at the point where we're here today where we can kind of talk about what does it mean for our community, for our agency. I think really broadly, a CCBHC is a national model. It's a national certification that has about 180 individual criteria that an agency has to achieve in order to be certified. I think overall, some of the types of things that it allows us to do is really to improve access to care within our community, just really broadly around access. And it requires and allows us to provide services that are more integrated, I think, within the healthcare system, partner with other agencies locally. And it's really around just ensuring that people have access to mental health and substance use services that they need.
Which is terrific, and I know, as you said, Todd, for years this has been worked on. This was not an overnight slam dunk by any means. It took a lot of work, and we'll talk about that as well later. But how will becoming a CCBHC benefit our community?
We've talked to the community, and we'll get into this a little bit more later. And one of the things we've heard from them is that they really would like to see stronger access to needed services, both mental health and substance use programming. This does allow us to provide care to those in need in ways that might be new, that might be different from the way we've done that before. It allows us to shape our services to better meet the specific needs of our community, which is something that we're really excited about. It does. We believe it will definitely link us with our community partners, be it our NMC, our local police, our primary care offices such as the Notch. It will allow us to think about whole person care and provide services in a more comprehensive, holistic kind of way and coordinate those services. And then a couple of areas I think it does allow us to kind of lean into in ways that we haven't before are around veteran services and elder care services. We know those are two specific populations in our community that require a certain specialty kind of care. And being a CCBHC will allow us, we think, to meet that need in a better way.
And I will say that to the point, like on the veteran services, one of the things that we'll be doing is actually next month, we'll be talking about how those services are going to be shaped. And I think it's so important that veterans understand that, there's the VA and everybody understands that, but we're in Northwestern Vermont. and to be able to provide them and also coordinate for them services that they need. Because I know so often, as we all know, many veterans, when it comes to mental health, substance use, those sorts of things, they just don't want to talk to anyone. So it's great to be able to offer services at another level now.
And Joe, I just wanted to also mention that one of the focuses of CCBHC is very specific to veterans and military individuals themselves, but we also really are hoping to expand those services to their families. We really see in our community that families are the ones really helping to support the home environment, kids attending school, and being part of the fabric of the military community really has a unique set of experiences that we're hoping to support as well.
Yeah, that is a great point. It is really totally family-based,
Yes.
and the impacts that has. So what steps did NCSS take to successfully achieve this certification?
Yeah, I'll talk about that one. So we've spent a lot of time over the past couple of years pulling together all sorts of information from the CCBHC model and SAMHSA to understand what does it mean to be a CCBHC, and working with our state partners to understand what does that mean in the state of Vermont. It's a little bit unique in that the state has some pieces they get to adjust, and we have to follow the SAMHSA guidelines. So we've worked on reviewing our policies, our programs, all the things that we've offered for years and years to see where are there gaps in the criteria and what can we do to address those gaps. The first step we took to address those gaps was to look at our community needs assessment. And Joe, this was a really awesome experience where we got to interview folks in the community that we serve, people that we work with, our community partners, ask them a whole bunch of questions about what does mental health and substance use care look like in Franklin and Grand Isle County. And that opportunity really gave us shined a light on where people see the gaps. And so we're taking that information and we're looking at the recommendations and improvement opportunities to enhance our programming, our staffing, also looking at what partnerships do we need, what technical assistance do we need from the national partners as well as our state partners. And so it's been a labor of love to really scrub through everything, but it's been an awesome opportunity to look at all the great work we already do and where we have some gaps.
And I think that's a big thing, as we're sitting here, is that NCSS has already been doing great work.
Yep.
This is just a way to form the model and move it forward so that you're trying to address some of those gaps that have been there for, quite frankly, for a long time.
That's an awesome point, Joe. I think it's important to note that we're going to talk about the 9 core services. A lot of them we've already always done. This is a little bit of an exercise of documenting the good work that we do and putting it to policy and making sure practice aligns. And we've worked with our focus group, which has really driven that bus, and it's been an awesome opportunity.
You mentioned in your commentary SAMHSA.
Yes.
Could you, for the viewers and listeners, explain what that acronym is for?
Yeah, I can
explain it. Because they probably are not aware.
Sure, thank you. I can explain it. I don't know that I'm going to get the acronym complete, but basically SAMHSA is a federal agency that provides funding opportunities for mental health and substance use services across the nation. All types of different grants come from SAMHSA. We've had SAMHSA grants in the past. It's just the governing body for the money that we're able to use when we have those opportunities.
They help ensure, I think, quality. They help ensure some level of standardization across the whole country.
Yeah.
So when we do say we're a CCBHC here in Vermont, that means something. It means something similar if you say you're a CCBHC in a different state.
Sure.
So there is a level of standardization within that does include using best practice, making sure we're using the right types of treatment to help people, and it creates a standardization across the entire country within that structure, which is good to have that oversight.
It's much like, we're talking about mental health and substance use, but it's much like the Notch, which is a federally qualified health agency from a medical standpoint.
Right.
So, they have to follow standards as well, from a federal standpoint. I guess what I'm getting at is if for those those locally who might be familiar with Notch, they are from a medical perspective what we're talking about from a mental health and substance use, even though but the beauty is linking everything together. The whole person, and that mental health is just as important as physical health, and everything kind of comes together in one being as well as they possibly can in living their life. So what if people are underinsured or uninsured? Can they still get access to a CCBHC and the services provided?
That's a good question, Joe. I know that CCBHC promotes the idea that services are available to individuals, regardless of their ability to pay. And what that means at NCSS is that we're offering treatment based on your needs and not based on your insurance status. And so we look at someone's assessments and evaluations to see what kind of services do we offer that they need, and give them the opportunity to engage in those services. And if they're unable, or if they have any challenges paying, we offer things like sliding fee scales and financial arrangements. And anyone who is seeking services that needs more than what their insurance might pay for, we ask them to reach out if they need help paying for those things, and looking at that from that perspective. It's an opportunity to remind folks that we are here for you, and we will work together to make sure that folks are offered the services that they need.
Yeah, that's terrific. So what does whole person care mean in the CCBHC model, and how does it improve a person's overall care experience?
Yeah, this is a part of the model that we're really excited about. I think that, to Todd's point earlier, it is a nationally normed model, so it's very specific that there are certain criteria we need to meet. And then we look at our community needs assessment to make sure that it's really specific to our Franklin and Grand Isle communities. And one thing that we're really excited about with the whole person care perspective is that we're really good at providing mental health treatment and now substance use care to both adolescents and adults. But that medical component, that physical health, is something that we have maybe tiptoed into a little bit. And CCBHC really requires us to ask at the intake, at the assessment, like, what are the chronic conditions that you're experiencing? What are things that are physically impacting your ability to achieve whole person success and well-being? So we, at a real technical level, we now have an enhanced assessment process that allows us to understand the individuals that we're serving really comprehensively. And then a really important and a very vital tenet of CCBHC is care coordination. And so Tricia talked earlier about like formalizing our partnerships and formalizing agreements. That happens through an MOU process, which allows us to be really specific in how are we going to partner together to provide the whole person care that individuals that we're both serving deserve. And so that care coordination agreement will really identify that, as an NCSS provider, I might be really specialized in these ways to support the individual's mental health and substance use needs. And I know in order for them to be successful at things like eating appropriately and sleeping appropriately and getting their diabetes care, I need to be in really close contact with their primary care physician and with other providers on our care team. Yeah.
So what are the core services that CCBHCs provide, either in a direct way or through these formal partnerships that you mentioned?
Yeah, so Tricia alluded to this earlier, that we as a designated agency already provide a lot of these services. And so crisis services that people are super familiar with, our 24-hour crisis care continuum includes our enhanced mobile crisis outreach team. Our 988 services that are provided through NCSS is already something that's been established, and this allows us to really expand on those services to meet people where they're at. Screening, assessment, and diagnosis is really important. We want to make sure people are getting the care that they deserve and that they need. Patient-centered treatment planning. So this kind of also goes back to whole person care. So this idea has been something we've been doing at NCSS for a long time, but it really identifies that patient-centered treatment planning includes anyone that they might come into contact with. And so we want them to be drivers of the services that they're receiving, including coming in for an appointment, and they might have some experiences in the past with being in big groups in large areas. And so our front desk team might know that this is an individual that might need a little bit more of a space that feels more comfortable to them. So our patient-centered treatment planning is really about listening to our clients, understanding their needs, and then educating everyone that might come into contact with them. And there's some training that is involved in that, which is required as a CCBHC. Our outpatient mental health and substance use services we already provide, and this continues to be provided. Primary care screening and monitoring, I mentioned a little bit earlier. Case management, community skills work, we already provide those services. This allows us to provide more. Some might hear the term psychiatric rehabilitation services, and those are the same as our community skills work. So I don't want people to be nervous about that term, but it is a national term. And then Todd talked about our enhanced supports for veterans and military members, and also our peer supports is going to be, again, really exciting with CCBHC to be able to hire people with lived experience and work with individuals in whatever realm of service that they need. And it's really exciting to be able to do that work with the state and to expand on people's knowledge and benefits to our clients.
Yeah, certainly the people with lived experience, I mean, bring so much to the table, that's excellent.
I just want to add real quick that along all of those services, we have capacity to provide them, but it also is impossible to do this work without all of our partnerships. And so we've mentioned a couple of times formalizing partnerships, and what we've learned through this process in our community is we have really good relationships with a lot of our community partners. And so we have a focus of enhancing those even further. The primary care providers in our community, the people who already do work for veterans and military members, the groups Pathways Vermont, which is one of the big groups that supports the peer support work, and just housing, food resources. This really is just formalizing all pieces that might touch someone's life and working together to help our community.
Yeah. So piggybacking on that, in what ways can this model reduce unnecessary emergency room visits, hospitalizations, involvement with law enforcement, or again, gaps in care?
Mm-hmm. Yeah, we've already seen a decrease in the use of hospitalizations in our community, which I'm really proud of. We're all really proud of. Our enhanced mobile crisis team has really become a valuable asset to our community, which again is a program that goes to individuals where they're experiencing that crisis, that need for support. So we've already seen, our most recent data shows a 10% decrease in our emergency visits in our community, which again, we're really proud of. But that's really a pivotal point in this work. And then we always think about the way to avoid a crisis is to intervene as early as possible. And so we have a lot of preventative services at NCSS. CCBHC requires us to make sure that we're looking as closely as we can to access points so that people are not only receiving the treatment that they need, but they know where to go to find that treatment at any point in their recovery journey. So we've opened the Access Center. I think you did a little interview with Megan Malbuff recently around our Access Center, and we've seen it becoming very used, people dropping in for those early morning appointments and receiving care in the amount of time and the intensity of work that they are requesting. And what I really like about thinking about reducing interface with whether it be the hospital or with law enforcement is that people are coming to us when they need us and we're able to get them right in. Like our wait times for services have drastically decreased from point of call to seeing someone. We can see someone within 24 hours. CCBHC requires us to do an assessment of a full comprehensive assessment of their needs within 9 days. And so individuals will receive those full services within 9 days. And just as a comparison, we were out about 6 weeks, 6 to 8 weeks in some circumstances prior to this model. So we're really excited about being able to intervene early and make those impacts. I also just want to say this isn't specific to CCBHC necessarily, but one of the ways I think that we meet the needs of reducing law enforcement interaction is, or maybe even further law enforcement interaction, is with our embedded clinicians. We do have 2 with the Vermont State Police, and we have 1 with the city PD, and we've received a lot of feedback that really reduces recidivism with individuals that interface with law enforcement.
Yeah, absolutely. And you mentioned a couple of programs there, Belinda, which I just want to let viewers and listeners know that, first of all, the Enhanced Mobile Crisis program was on last month's program, and as you said, the Access Center about 4 or 5 months ago. And the only reason I want to bring that up is people can go to the NCSS YouTube channel, find those episodes, and either watch or listen to them at any time. So they can learn a little bit more about those programs that you had just mentioned.
Yeah.
So how does the CCBHC improve support for people with substance use disorders, including access to evidence-based treatment and recovery support?
Yeah, so at NCSS, we have provided services for adolescents receiving substance use care for many years. We did not provide that care for adults. Howard Center provided that recently in our community, until January 1. And so we have now taken over those services. So that includes individual services, individual outpatient services. There is some family work looking to be developed. We also do group therapy work with those with substance use issues. And one of the things that we're really proud of is that, and this is a requirement of CCB, is that we have to have an intensive outpatient program. And so that's not something that our community is really used to having. Howard Center did try to provide that service, but it wasn't as successful. So they gave us some pointers, I would say. And so we've been working with our primary care physicians, with our hospital partners, with probation and parole, to talk about how we can create an intensive outpatient program for individuals who really need that level of care in order to be successful in their recovery journey. We also have started providing MOUD and MAUD services, so that's medication assistance for opioid use disorder and alcohol use disorder, and that is supported through our nursing and psychiatry team. So we are accepting referrals for that treatment as well. And then we're also enhancing our nicotine replacement therapy, which is also a model to really, intervene with those wanting to recover from nicotine addiction. And back to Tricia's point as well, I think one of the pieces that's also really important when we think about substance use disorders is the recovery process, and peer supports being part of that recovery process. And so we have really great relationships with Turning Point, and we've created an MOU to really talk about how those referrals will go, how our partnerships will go, how we can work together, knowing that peer recovery is a really substantial piece of the recovery work. And then I will say that when I'm talking about substance use treatment, it always sits in like an outpatient and a therapy model, but we've also created trainings to support our case managers and our skills workers so that when they're working with an individual outside of their therapy, they will have reinforcement around those behavior changes.
Mm-hmm. Yeah, it's just so important because it isn't a one size fits all, and it isn't a quick fix, and there's a long recovery, a long road.
Right.
And it sounds like all of those areas have been addressed, which is great. So, what will children, families, and older adults and community members notice that is different or better as NCSS begins operating within the CCBHC model?
Yeah, I think we've talked about a lot of it today.
Yeah,
I think, back to some of the things Todd and Tricia have talked about, I think our formal agreements with community partners, care coordination is a vital piece of this model. Our expanded services to veterans, elders, their families. I also will say that what I'm excited about is we talked about this being a national model, and we talked about SAMHSA being the funding mechanism around this. So what that actually does is it changes the way that we are funded as a CCBHC. And so we've actually brought funding into the state through those federal relationships in order to pay CCBHCs a little bit differently. So before, we were provided a budget as a designated agency, and we were doing the best we could within that budget. Now we're actually going through processes to identify how much it costs to provide the services that are required as a CCBHC and defined through our community needs assessment. So we are embarking on a very new process that says we know that our clients need the best quality care, and we need this staffing pattern in order to achieve that. So what I'm excited about most recently is that in my division right now, which is where most of the CCBHC services live, I have about 170 staff. And when we did this first costing analysis, we added an additional 33 clinical positions. So my goal with that is to hire people at a wage that is appropriate and valued by all of us, to enhance the services provided to our community. And what I'm hoping is that we know that interruption in services by staff leaving or by staff not having enough time in their day to see individuals can reduce recovery, can impact our ability to help clients feel successful in their journey. So we're really hoping that clients will see less wait time, more services, more quality services, and happier staff, right? So we already pride ourselves on the culture at NCSS being really positive. Like, we invest a ton in our staff, and we're hoping this will continue to provide that.
If I could add to that very quickly, I think one thing that stands out to me for listeners and viewers to consider is that as we talk about this exercise we do to say, how much does it cost us to provide care in all of these realms, we need your feedback. And so when we're asking for community needs assessment surveys, or we put out surveys online that we're asking for feedback, we really hope that folks will provide that so we can continue to be innovative and cost in a way that can have people served.
When I think of our CCBHC certification, it's brand new. I mean, this was just July 1 when we got this. So I do think we've got some really good ideas that we're going forward. But, as I think both Belinda and Tricia said, this is a dynamic process. We are in the process of gearing up for our next community needs assessment. We're going to partner with NMC and the Notch, hopefully, to do a single community needs assessment for our community together. And this structure, CCBHC structure, allows us to flex our services to better meet the community needs as those needs change. And it builds in a structure for us to ask those questions, really listen to the community, learn about what it is that they need, so we can always adapt our services to meet those needs as they change. So that's one of the things I'm really excited about with CCBHC.
Yeah.
Yeah, it is so critical, listening to what they need and then providing what they truly need. Now, I want to get one more question in, but I'm going to tell you right now, we only have about 30 seconds or so to answer. So think about how you're going to shorten this answer, short and sweet. But looking ahead, how will the CCBHC certification help NCSS to build stronger relationships, measure outcomes, and to continue improving behavioral health care in our community?
I would probably just reiterate again, it's designed to partner with other agencies, be it healthcare, housing, employment. We know those are all really important parts of a person's overall health. It's hard to address a mental health issue or a physical health issue if people don't know where they're going to sleep at night.
Sure.
So it does allow us to bring all those things together. And then again, it requires us to ask our community and listen to our community to learn about what they need and then adapt to better meet those needs. So I do think that's kind of some of the things that we're excited about, that where we're going to go in the future.
Sounds great. Okay. Well, I do want to thank my guests, Todd Bauman, Belinda Bissett, and Tricia Ketchum, for sharing their insights on NCSS achieving Certified Community-Based Integrated Health Center status and what it means to the residents of Franklin and Grand Isle counties. I also want to thank our viewers and listeners for spending time with us again this month. You can learn more about all of our programs and services by logging on to ncssinc.org. I'm Joe Helko, and I'll be back next month with another episode of NCSS Here for You.